So great, guys. We are actually live onto YouTube, and it's so nice. I mean, trust me, when I started this entire initiative for patients, I had actually started it on request of one of my patients who is now on the sixth year of follow-up with me, and she was like that, you must do something on YouTube or on these platforms for the patients. And honestly, only because of her, I'm actually doing this, and I am so amazed that close to 350 people have joined our WhatsApp group. I'm genuinely so amazed about two things. One, people want to know about endometriosis, and second, people want to speak to me because I carry a very low impression of myself in my own mind, and I'm very very happy. So what we are going to be doing is I am not going to be wasting much time for people, right? I am going to be speaking about Dienogest, and I'm going to be helping you understand Dienogest for all the girls in the next exactly 10 minutes. Nothing more than that. All right. And I will be drawing it. So this is going to be more like a classroom where I will be drawing about Dienogest so that all of you can understand. So let me just start screen sharing on this. And I guess Nehashri can probably tell us if the screen is visible or not visible. Yeah. So Snehashri, I did try to actually unmute you. Okay. And I guess you should be able to tell me if uh, if the screen is visible or not visible. Okay.
Yes,
So
it is visible.
okay, great. So kindly stay unmuted, Snehashri, and help me out as a good girl you are.
Sure,
You know.
sure, sure.
And yeah, so let me now find out. Yeah, okay, so this is free form. And so okay, so all the ladies uh basically who have joined here. Okay, it's important that you understand two or three things. Okay, as far as this entire disease is concerned. Okay, so basically here, girls, we are going to be trying and speaking about Dienogest. I hope you can read that, Snehashri, on the screen. Right. So we are going to be speaking about Dienogest and what's important to understand. Okay, just understand this. See, every lady, okay, has this. This is called as the bladder. Behind the bladder, every lady has a vagina, and then there is a uterus above the vagina, and then there is something called as a rectum, which is a stool pipe. Along with this, every lady has two ovaries, and every lady has two fallopian tubes like this besides the ovaries, right? Now this endometriosis, this notorious disease, is when basically you have chocolate colored infiltration of altered blood either in both the ovaries, or you have it in the uterosacral, or you have it in the rectum, or you have it in the bladder. Basically, this is an abnormal deposition of the endometrial tissue which is present in the uterus. This is the only thing which you need to understand if you are a lady. Okay, so endometriosis basically means it is abnormal deposits, okay, outside the uterus. That's it, right? Now, we all know as we speak that when we are speaking in 2026, the treatment of choice is to do surgery, correct? But let's talk about a normal patient situation. When the patient understands, majority of the times the patient ends up going to a gynecologist and not an endometriosis specialist. So the gynecologist is going to put you on something called as Dienogest. People think that Dienogest is going to cure you out of endometriosis, which is absolutely incorrect, right? And this is what we are going to address. So basically, please understand Dienogest as a drug, okay, or VISANNE or any other combination, whichever you must be using in your country or in your city, is basically available as a 2 mg combination. All right. And this tablet needs to be taken by you daily, preferably at the same time. Okay. And it needs to be taken continuously. Means you cannot be taking a break when you are on Dienogest. Okay. So when you take the tablet continuously, basically it will stop your periods. Okay. So when it stops your periods, it prevents this disease from growing. This is all that you need to understand if you are a lady. Correct? Now, Please understand two or three more basic things, and this of course everybody knows, and people have complained about this, and when they speak to us they tell the same thing, that remember one thing guys, Dienogest is associated with a lot of mood swings. Everybody knows this. Dienogest can cause water retention, so it can cause you to gain weight. Okay. Apart from that, Dienogest can also cause loss of interest in things. Okay, so you will feel very drowsy during the day. All these types of things can occur on Dienogest, though science says that Dienogest can be technically safely used for at least 18 to 24 months. That means for 2 years you can use it. But the problem of Dienogest, no, is not all of this. I'll tell you what is the problem of Dienogest, and which is, of course, this is all science, so it is all documented, my dear friends. The problem with Dienogest is it is very, very temporary. That means only till you take Dienogest, you will have effect. And Dienogest is only used to reduce the pain associated with endometriosis. So what's going to happen is this disease will keep on growing from inside, but you will have no pain. So what you will feel, array, I'm doing so well in life. I have no pain. But if you follow up the disease diligently, then you will realize that the disease is present like there only. That nothing has happened to the disease. It is present at its spot, but now you don't have pain, and that is the reason why it is temporary, and that is the reason why you need to do a surgery to remove the disease. Understanding? Just some basic understanding to all the people. If I just take this nodule and if I magnify it under the microscope, okay, you will have endometriosis here, like this full scar tissue. There will be a lot of blood vessels which is supplying this, right? This is all the blood which is coming inside. So what does Dienogest go and do? Dienogest is basically going to cut off the pain supply from this simultaneously, because Dienogest is a hormone. So all the girls who believe Dienogest is very safe, please understand Dienogest is actually a hormone. It is actually a hormone which is something called as progesterone. Okay, a byproduct of progesterone. And as a result of this progesterone has a negative effect on the lesion. But the minute you stop Dienogest, the progesterone effect goes away, and this entire disease will come back to you completely. Okay, complete recurrence. The whole disease is going to come back to you. Now, this is where, as a patient, you need to meticulously understand that, okay, I am on Dienogest. Okay, very good. And whenever I'm on Dienogest, I need to understand, or I need to make sure that a patient on Dienogest goes and visits a specialist. Okay, when this patient goes and visits a specialist, two things will happen. Either the specialist will tell you that, okay, you need to undergo a surgery, or you have visited a specialist so that you can undergo a surgery. Or the third thing which will happen is your specialist will tell you how much more you can hold on to. See, the commonest question in our country by women, most of the women ask this question is that, okay, doctor, I don't want to do a surgery right now. What do I do in that situation? Right? Let's say you are working, you are studying, you may want to get married, or 100 other problems, correct? Please remember, let your doctor, who is an endometriosis specialist, judge this for you. Don't judge this on your own. Kindly don't judge this, let's say, based on, I've told this to Snehashri and to so many other girls, right? Don't judge all the things which you read on, let's say, Facebook, or let's say Google, or wherever. These things which are written on Facebook, on Google, are mostly paid influencing stuff, right? People like me, we have never written down anything on Facebook. We charge them to write, correct? As I said, in my 12 years of my career, this is the first time I'm seeing an audience which is a patient audience and not a doctor audience, right? This is the first time, which is why I am more nervous than most of you, to be very honest with you, because this is the first time I'm doing something like this. But if you are a lady on Dienogest, kindly make sure you visit an endometriosis specialist. Kindly make sure that you find an endometriosis specialist. Kindly make sure that you go to somebody who is knowledgeable so that the person can help you out in your disease. And kindly don't choose comfort. Don't choose things which are shortcuts. That okay, let me be on Dienogest, nothing will happen. Wrong. The disease may go up even if you are on Dienogest. And the minute you stop Dienogest, the disease will come back. Right? So you are choosing a temporary management. As a patient, basically, you should understand that that is it. Okay. Since this is a very small class, I'm sure we are going to have more classes like this. And because I mean, this is the first time, as I said, I'm doing it. Maybe one or two questions, just in case somebody has. You can probably raise your hands. I'll try to unmute you so that if you can, don't scold me when I unmute you people. Okay. You are just supposed to ask me a medical question. Okay. Okay. So we have three questions. I will allow the first one to be unmuted. Unfortunately, I can't see your name, but I'm still wanting to unmute you. I guess it is, I can't see the name. I think it's Motorola. I don't know.
Hello,
Yeah. Hi.
am I audible, sir?
Yes, you are audible. We would like to see you and we would like to also know your name if possible. If you want to share, kindly note it's live, so you can share your name just in case you want to.
Uh, Sir, I'm Adrita. I'm from West Bengal, and I was diagnosed with endometriosis last year in the month of May or April. And I went to a gynecologist, and I was on Dienogest for approximately 9 to 10 months.
Correct.
And according to him, the size will reduce. And I was very hopeful that why to go for surgery, because the doctor also, can I say in Hindi also?
Yeah,
Like,
yeah. Hindi
yeah.
is fine. I am educated from Hindi medium, so please speak in Hindi.
या सो डॉक्टर ने बोला था कि साइज रिड्यूस हो जाएगा एंड वाई टू गो फॉर सर्जरी, यू आर 25 मीन्स दैट टाइम आई वाज 25 लास्ट ईयर। तो अभी तो शादी भी नहीं हुआ, क्यों सर्जरी करवाओगे? फिर से आएगा, सर्जरी करने से भी आएगा, तो गो फॉर मेडिसिन। एंड ईच टाइम आई यूज टू विजिट हिम 3 months बाद तो ही यूज टू सी द रिपोर्ट एंड ही वाज वेरी मीन्स रिलक्टेंट टू गिव मी द मेडिसिन अगेन, बिकॉज ही वाज फॉर कि शादी कर लो, बच्चा कर लो, बस दैट्स इट। एंड फिर मेरा 9 months 10 months के बाद फिर से मेरा यूएसजी किया, तो फिर एडिनोमायोसिस भी आ गया, मीन्स मैंने और भी क्रिटिकल हो गया केस। तो मैंने सोचा कि नहीं, मेरे को और इधर तो रहना नहीं है। तो देन आई सर्च फॉर सम एंडोमेट्रोसिस सर्जन्स एंड आई गॉट वन फ्रॉम ओडिशा एंड आई वेंट टू हिम। एंड फर्स्ट सेशन में उन्होंने मेरा वो एमआरआई भी हुआ था कुछ इंडोमेट्रोसिस प्रोटोकॉल वाला। तो वो सब देख के उन्होंने बोला कि ये तो ग्रेड 3 या ग्रेड 4 के आ गया है सर्जरी। एंड मेरा में सर्जरी हुआ है। एंड उसके बाद 1 month के बाद मेरा वो ल्यूप्राइड इंजेक्शन भी मेरे को दिया गया है, वो 22.5 वाला, शायद वो 6 months का जो है। एंड प्रेजेंटली मेरा वो होता है ना, लूमिया 60 के चल रहा है एंड कुछ सप्लीमेंट्स काइंड ऑफ चल रहा है
Right.
प्रेजेंटली।
So sorry, but I'll just interrupt here.
या
Okay. Basically, this is something which everybody should understand, as the young lady has shared. Dinogest does not cure you, which even she has said. Dinogest, this promise that the size of the disease may go down, it may go down. It is not a promise. Please remember, getting married is not a management of endometriosis, right? Of course, one can attempt a pregnancy, right? But getting married or becoming pregnant does not cure endometriosis. So please remember that in life for everybody. As this young girl has gone to some endometriosis specialist somewhere in Odisha, it is great. But please remember, before I conclude, this is going to be the concluding remark. So please remember, before I conclude, uh, kindly, if you are a lady, don't take your health very lightly like this, right? Kindly make sure that you may go to a specialist as and when it is indicated, get their opinions, and get treated from them nicely. This is the only thing which matters. Just in case you are on Dienogest, please remember and please note that it is a temporary management. It is not a permanent cure, as some patient from West Bengal, as we just heard this young girl, has shared it, right? Uh, Before I conclude, really, trust me, I thank each and every one of you, for coming inside for a patient webinar like this. I think 50, 60 people have attended this. My God. Okay. And this is going to be available on YouTube, just in case anybody wants to see. And all of you, as I've said, can probably join our WhatsApp group. I will be posting some questions for each and every one of you on our WhatsApp group. Correct. So just in case you want more classes like this, you can probably just tell me that yes, you want more classes. If you want it to be more simplified, uh, I'll make it more simplified than this. And this is where we would end. I apologize. We can't have more questions or we can't have more members to speak, but we will keep one class or one webinar if everybody is interested, where I can answer maybe 5 or 10 or 20 questions from people. Okay. And hopefully it will help you settle down your anxiety. Okay. So thank you guys. And thank you, Sneha, uh, for being such a good sport and for doing this. And all the best to everybody. And kindly get back to work because I also need to go back to the operation theater. And I will be helping you out on the WhatsApp group. Thank you and bye bye.